Hello and welcome to Courageous Doctors, the new show for you and your doctor. Today we're going to cover three areas: Obamacare updates, new and emerging health problems around the world, and health and safety tips. Let's now begin. The 2015 open enrollment for the health insurance marketplace will begin November 15th and continue through February 15th. The coverage for 2014 is going to end December 31st. Elsewhere in Obamacare updates, the Kaiser Health Insurance News says that 15% of the population is still uninsured, and these are mostly minorities, and this is due to language barriers, cultural, and immigration issues. The Congressional Quarterly says that no state will see a decrease in the amount of insurance companies on the exchange, and some might increase. Wall Street Journal says that the Health and Human Service Secretary Burwell says that insurance companies participating in the exchanges will increase by 25%. Reuters says that the U.S. District Court has ruled it illegal for participants in the federal exchange to receive money-back subsidies. Private states can, though. The U.S. News and World Report says that the insurance companies will make you pay more for some drugs by putting these drugs on the non-preferred list, so watch out for that. USA Today says that hospitals will now be cut $5.7 billion in payback for poor patients. However, Associated Press tells us that there's a 30% drop in hospital admissions of the same uninsured patients. The Associated Press says that Walmart is now eliminating health care benefits for 30,000 employees, which is about 2% of their 1.3 million staff here in America. These employees were part-time and must now go on the exchanges. The Star Ledger says that nearly one half of the uninsured are self-employed or work for a small company. The Affordable Care Act shop exchanges now must attract a large pool of these to bring down the insurance cost.
My goal is to get the body comfortable so it can function at its full potential, enabling them to smile from the inside out daily. I will help both you and your child understand that being healthy is not just an absence of disease, it's having vitality. I believe that life is a journey, not a destination. I will help you enjoy the process of guiding your child to living a better quality of life and being the best that they can be. I look forward to helping you. Thank you for listening and keep smiling.
Hi, I'm Ingrid Burke.
And I'm Gina Unger.
Gina has known Dr. Berry in a professional and personal capacity for many years, and we are thrilled to be in his building. We are psychotherapists and we offer mental health counseling for ages 12 and up. We do individual, couples, and family counseling. We're also excited to say that we have groups that we have for teenage boys and girls for social skills, anger management, and self-esteem building. If you need to reach us,
check us out at lifeworksnj.com.
Our phone numbers are also listed on that website if you'd like to contact us. Thank you.
Thank you.
Let's move on to other healthcare news. And of course, leading the news is the Ebola outbreak. The Center for Disease Control intercepted a sick passenger at the Newark airport on October 4th. The patient was suspected of Ebola infection. This turned out not to be the case. The patient was isolated at the airport facility and transported to a nearby hospital where he was released. Now, we all know that one man had died in Texas who had returned from Africa with the Ebola. And the contacts that took care of him in the Texas hospital, two nurses who are now infected and are now in specialized hospitals caring for Ebola, they became infected in Texas due to improper protocol in dressing and caring for this patient. They were improperly protected. And one other patient who was recently said to, one other healthcare worker caring for this patient who was found on a...
Start that section again, Doc.
Okay. Where do I start it from? The one man that died in Texas?
Yeah.
Okay. One man returning from West Africa died in a Texas hospital of Ebola, and the country is now trying to find all of his contacts. We know that 2 nurses who cared for him in the intensive care unit at this Texas hospital themselves contracted Ebola and are being cared for now in specialized centers in America, and one at Emory and one at the NIH Institute in Maryland. We also know that one of these nurses who had traveled to Cleveland, we're now trying to track down all of the contacts she had on the plane. And we know there's one other person, a healthcare worker that cared for the patient that died, who is on a cruise ship just outside of Texas in the Caribbean, and that cruise ship, I believe, is now being quarantined. The Washington Post says that emergency rooms are preparing isolation rooms all over the country now with the proper procedures to pick up these patients and the proper procedures to both protect people taking care of these patients. And what that means is that, unlike the 2 nurses that improperly were dressed to take care of the patient in Texas and they have Ebola, emergency rooms are going to make sure that they have gowns that cover the entire skin and also have a buddy system where the buddy can make sure you bleach or use chlorine to disinfect yourself before you take your gown off and to make sure you take it off correctly. This hopefully will protect future workers taking care of the Ebola patients. A survey by nurses, as reported in Fox News, says the majority feel they are still unprepared to take care of these patients. The Washington Post says that West Africa is likely to see 1.4 million cases by January, and of course we know 70% of these are going to die. The president has rejected a plea from Congress to restrict travelers coming from West Africa who are not United States citizens. The president believes it is better to allow these patients to be either quarantined if sick at the airport or followed to see if they get sick within 21 days of being quarantined, so that we don't, first of all, lose them to other areas of the world where they may spread the epidemic, and so that we can better contain the epidemic. In fact, the president has also sent a large armed force to the West African countries in a coordinated effort with the rest of the world to both supply money and manpower to build hospitals to try to contain the epidemic in West Africa. Moving on to other healthcare news, the first enterovirus D68 death occurred in a healthy 4-year-old New Jersey boy on October 3rd. The virus, which has spread nationwide since August, presents with severe respiratory distress. Another virus similar to it is causing nerve paralysis like polio, and these 2 viruses may be related. The ABC World News says that hundreds of children have been hospitalized now with this virus. Asthmatics are especially vulnerable. The Government Health IT report says the Health and Human Service is funding portable ventilators for hospitals in response to this outbreak. The Wall Street Journal says that we have 8,000 cases of whooping cough this year reported in California. This is up from last year. Dengue fever, which is transmitted by mosquitoes, is now being reported in Texas and Florida. An attempt to breed a mosquito which is unable to transmit the disease is underway. The CDC reports that 2 million young adults have chlamydia, and that it's important for those of us who are healthcare providers to screen all young adults with a rapid urine test for chlamydia. Los Angeles Times says that the president is creating a task force to reduce resistant bacteria, which the CDC director Tom Friedman says kills 23,000 people a year. In fact, there is a $20 million prize offered for developing a rapid test for these superbugs. Modern Healthcare reports a new rapid DNA test for colon cancer called Cologuard. The Star Ledger reporter Kathleen O'Brien has written a very interesting report detailing the value of vitamin D in her September 24th article. The majority of us in America are low in this vitamin, and this vitamin is helpful for organ function and even for many diseases such as asthma, lupus, and multiple sclerosis. The Star Ledger also reported on the Nobel Prize given for the discovery of the brain cells used to form spatial recognition, our so-called brain GPS. Now let's move on to healthcare safety tips. USA Today says that the House Oversight Committee investigated mistakes in labs dealing with bioterrorist germs. Star Ledger reports that smallpox, botulism, ricin, and plague were found to be stored incorrectly. The Star Ledger says that the Occidental Chemical Company is going to pay $190 million for cleaning up the Passaic River. However, hundreds of companies polluted this river, and in fact, the Occidental bought into this area after the pollution had occurred in the 80s, and the company will seek reimbursement from other companies who had polluted the river. Finally, New York Times reports that only a few medicines are found to cause the thousands of accidental poisonings in children under 2 years of age, such as Oxycontin, Percocet, Vicodin, Ativan, and Valium. And now for one final thought on the Ebola outbreak and the response from our country to it. President Obama yesterday appointed Ron Klein, who's well known to the White House staff, the previous chief of staff for Vice President Biden, and he was also responsible for helping us with the initial plan in the Recovery Fund in 2009. This is to coordinate all the agencies that are responding to the Ebola outbreak, such as Homeland Security and Customs, to check travelers coming into the country, to help the CDC get the message out on proper procedures that we have to follow in the hospitals and our offices, and all the various people involved in the country that are coordinating this outbreak. Now, I think this country is confused in terms of why we're having such trouble in terms of being prepared for this virus. Nurses, 80% of whom are complaining that they're unprepared and they're scared that they will get sick when they care for these patients. And doctors in hospitals and private offices say that they're also ill-equipped to handle a patient. For example, if an Ebola patient comes into a store or an office or an emergency room, it could, until that area is cleaned up, shut that area down, and anybody who's been exposed is now quarantined for 21 days and can't work, and this potentially could really cause harm to the country. Now, we're reassured that this virus is very difficult to spread, and so that unless you're actually in contact with this patient and taking care of them, such as a healthcare person, that the country probably has no fear. But what I'd like to explain now is what I feel is the confusion between why this country is having so much trouble preparing. And I think it's really very simple. You see, the government for many years, especially since 9/11 of 2001, has put together wonderful central plans at the top levels, such as the Center for Disease Control and Homeland Security, procedures that we can all follow. But what's happened is, like many other things in Washington, these procedures don't always get translated onto the local level. Myself, a small doctor in a small town, my hospitals, community hospitals, we are unlikely to be able to immediately implement the wisdom of Washington and the Center of Disease Control because we're not constantly practicing and seeing these patients. And the potential and the difficulty goes even further than our office. You have to remember, in an epidemic, it's one thing to have everything nicely put out on plans, but you potentially could shut down the moving of traffic, the moving of commerce, getting your water, getting your food, having banks and money available. You could potentially shut down an entire system. And so what we need is on a local level where it's happening, mayors and hospital administrators and doctors and business people and the business community, schools, we need to all sit in the same room and actually talk. What happens if we don't have any money and we need a voucher system? How do we keep our pharmacies open so we can have drugs, not just for a disease, but for the chronic diseases we have? In other words, these are the same kind of responses we would need in any disaster. And some towns, unfortunately, who have gone through disasters are maybe better prepared. But I think all of us should take the wisdom from Washington, which is very well put down, and we should really try to get together on a local level and really figure out how to do it. I think when that happens, you won't see as much panic and confusion in this response. Thank you. We'd like to know what you feel. Please write us and let us know.
I'm Lisa Dascoli.
And I'm Annie Weiss.
Tune in to Talk of the Town on BroadbandBoxOffice.com.
The second Tuesday of every month at 7 p.m.
And like us on Facebook and leave us your comments.
Hi, my name is Tom Ragu of the Tom Ragu Sit Down Comedy Show. You can listen to us at the Broadband Box Office, and for more information, please visit www.tomragu.com/podcast.
Hi, I'm Randy Lupo, host of The Randy Lupo Show on Broadband Box Office. Wait, is that a tongue twister or an alliteration? Come meet my favorite people, comedians, actors, writers, spiritual people, and everyone in between. I'm looking forward to seeing you.
How are you? I'm Bob Gonzo of The Bob Gonzo Show. And I'm here to introduce The Bob Gonzo Show to you. Watch The Bob Gonzo Show on ComedyMondays.com and iTunes. Once again, ComedyMondays.com and iTunes. Watch it live, or you can watch it on the archives, which means you can watch it forever. Bob Gonzo is the greatest show on the internet right now. It's the funniest, it's the sweetest, it's endearing. We have stand-up comics, we have bands, we have actors, we have people in the fashion industry. We have everything you need. So once again, the Bob Gonzo Show, the greatest show in the world. And if you watch it, you will become a better and happier and sweeter person. You. Watch the Bob Gonzo Show, everybody. Thank you very much. Thank you.
It's the Mark Daisy Show, filled with gifts, fun, and surprises, and $20,000 in cash for every viewer. Well, maybe not. But we do talk about stuff and things that you might want to think about after, before, and during the show. It's engaging, at least. So come by, won't you? We're here at Facebook, on iTunes. We broadcast from VK Media right here on the East Coast, and we're part of BroadbandBoxOffice.com. Check us out, come by, like us, do what you can, spend some time, take some time off, sit down, have a viewing. It's happening, it's now, it's controversial, or maybe not. But we could use a couple of more viewers, maybe starting with you. Won't you?